Your eyes are one of the most important organs in your body. Outside of getting corrective lenses or contacts for vision, we can sometimes take them for granted. But what happens when your eyes become blurry, red, teary, and inflamed? It might be a small irritant or it might be something more concerning, like uveitis. Joining us to discuss is Dr. Ahmed Salem, an ophthalmologist and researcher at the Jones Eye Institute at UAMS. This is UAMS Health Talk, the podcast from the University of Arkansas for Medical Sciences. My name is Prakash Chandran. So, Dr. Salem, thank you so much for joining us today. I guess I wanted to just start by asking, what exactly is uveitis?
Thank you, Prakash, for having me. This is a great question. So uveitis means inflammation of the uvea, which is a part of the tissues inside the eye. It's one of the coats of the eye. There's an outer layer, an inner layer, which is the retina, and the middle layer, which is the uvea. And that part can become inflamed, and that's called uveitis.
And what symptoms does someone experience when they have it?
So it depends on which part of this middle coat of the eye. So if the front of the eye is inflamed, patients would come usually with pain and red eye. They may also have decreased vision, but the prominent symptoms would be pain and red eye. And it can be so painful. If the back of the eye is involved, then they usually don't have much pain, but the presentation would be with floaters and decreased vision. It's less painful, but more serious because it has more impact on vision. And sometimes patients present with a combination of the two. So they will have pain, decreased vision, and floaters.
Okay, understood. And how common is uveitis?
So uveitis is very uncommon. So the prevalence is about 1%. But, and that's the problem, it can cause significant loss of vision. And you might be interested to know that 10% of blindness is caused by uveitis. So although the prevalence is just 1%, but it really can cause blindness.
So my sense is that as soon as you start experiencing symptoms, you need to get it treated right away because that early treatment is what can prevent a person from becoming blind. Is that correct?
Exactly. So, sometimes we get red eye and you go to an optometrist who are great for eye screening. But one thing really is good to know, if you're having a red eye and the eye is painful, or you have decreased vision, this is serious. And you need to see an ophthalmologist for this because this is serious. It's not just the usual red eye where you might be just prescribed some drops by your primary care physician or by optometrist. This is serious.
Okay, so just to be clear, for patients that are experiencing symptoms where they have red eye, it's painful, they have decreased vision, then they absolutely need to go see an ophthalmologist, right?
Yes, red eye with pain or decreased vision, or both. This is serious. It can be uveitis or it can be other serious things. For example, a corneal ulcer or something called acute glaucoma. There is some differential diagnosis here, but the most important message really, this needs to go to an ophthalmologist.
Okay. So who exactly does this affect? Does it affect a certain demographic, a certain age group? Can you talk about that for a little bit?
Yeah, so it can affect all age group. It's more in the working age group, like young adults. And that's, again, one of the problems really is that, it can cause significant vision issues in the working age group. So, but it can present in children, it can present in adults, and also it can present for the first time in elderly. But the most common group involved is the young adults group.
And Dr. Salem, what exactly causes uveitis? Is it genetic? Is it environmental? Is it something else entirely?
So this is really the million-dollar question. So what do we know? We know that this is inflammation inside the eye. It can be caused by just inflammation or autoimmune inflammation. The body's reacting to the eye as a foreign material, similar to how rheumatoid arthritis, for example, happens. And that can be restricted to the eye only, just uveitis, or it can be part of more of a systemic disease involving the whole body. For example, rheumatoid arthritis can also affect the eye, or a disease called lupus. That's one part. The second part is an infection, and that's not common. An infection affecting the eye. A third part is could be due to tumors just manifesting with inflammation inside the eye. But the most common we see is in the first group, which is inflammation. And under that, the most common we see is just affecting the eye. And under that, we cannot find any other causes. So the most common is autoimmune, just restricted to the eye. Autoimmune inflammation, just restricted to the eye.
So you talked about going in to see an ophthalmologist right away if you're experiencing some of these symptoms. How treatable is this, and what exactly are you doing to treat it?
So the good news is treatable, and that treatment can differ really depending on where and how severe the uveitis is. For example, if you have only a uveitis in the front of the eye, then you mainly get treatment with topical steroid drops. And that can range from just a 6 weeks course to a longer course if the inflammation becomes what we call chronic or means like longer taking. Then if you have more of a posterior or the back of the eye problem, then as you would imagine, the drops would not reach back there. So then you may need treatment by mouth or in the form of injections around or in the eye. It depends.
So we talked earlier about not really understanding the reason around why uveitis happens, but is there a way to actually prevent it?
I think that's the second $1 million question, really, because is the stress really a factor? Is diet really a factor? Personally, I think yes. There's maybe an element for diet, really, maybe there's an element for stress, but there's no proof. So I would say, but this is really unproven, and I think this is just my thinking, a healthy diet, exercise, not smoking, avoiding like preserved food. I'm sure that this prevents, or I'm not sure, I think strongly that this may prevent inflammation and many eye disease. But is this proven? No. So maybe the message really on this part is, I think, seek help if you have one of the symptoms discussed, but there's no definite preventative treatment.
So I think the major takeaway that I certainly get out of this conversation is if you or a loved one, inflammation, red eye that's painful, or you have decreased vision, or both, you should really go to an ophthalmologist immediately. And I think the reason this is so important is that typically when we experience these symptoms, it's very easy to write off as, something that is going to clear up in a couple days. But it really feels like time is of the essence when it comes to treating what might potentially be uveitis. Is that correct?
Exactly. I would totally second this. I think this is really the main point.
So, Dr. Salem, is there anything else that you would like to leave our audience with today with regards to eye inflammation or uveitis?
I think we covered most of the important points. Again, I think the message we just talked about, if you have this, then do get in touch with us. We'll be very happy to review the patient. But otherwise, I think we've covered all the elements.
Okay. Well, I really appreciate your time again. Thank you so much for being here, Dr. Salem.
Oh, thank you. Thank you so much.
That's Dr. Ahmed Salem, an ophthalmologist and researcher at the Jones Eye Institute at UAMS. Thanks for checking out this episode of UAMS Health Talk. You can visit eye.uams.edu to find out more about the expertise and services offered at the UAMS Jones Eye Institute. And for more generalized information, you can visit uamshealth.com. If you found this podcast helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. Thanks again for listening. My name is Prakash Chandran, and we'll talk next time.